Last year, more than 49,300 suicide deaths were reported in the U.S., says Children's Mental Health. This means that every 11 minutes, a person in the wealthiest nation of the world takes their own life. Coming to terms with this statistic aids in realizing that too many in the U.S. are struggling mentally and this severely. What has the U.S. done in the face of this mental health crisis? What has worked? What is not working? As a teenager in high school, I've witnessed my peers' need for solutions to poor mental health, as well as the popularity of taking medication to be that solution. I have thus conducted research utilizing our nation's government databases, institutes, and administrations to investigate the supply and demand of prescription medications for mental health in the U.S. As the listener, you may ask, why solely investigate the U.S. and its condition? To that I answer primarily that the U.S. has the highest suicide rate in the world among wealthy nations, despite its heavy investment in medical research, specialized care, and wide-ranging pharmaceutical access. I, among doctors, business owners, politicians, and many others in this nation, acknowledge this growing problem but disagree on how this problem should be addressed. Many thoughtful people, when discussing the state of mental health in the U.S., ask why, in a country where food is abundant and people are safe, is mental health such an issue? Alex Honnold, a professional free soloist, a rock climber, who has met with life-or-death situations regularly, claims that if you don't experience real danger, then your mind creates fears out of nothing. He goes on to share his observations on the people around him, describing how people experience debilitating levels of stress and anxiety when they simply do not need to be. It is thought by people like Honnold that if these stressful people, who live in a safe environment where they can relish in some of the most dopamine-filled experiences on planet Earth, daily and without second thought, had to face the tragic reality for roughly 190 million people right now in the sub-Saharan Africa, they would not be so unnecessarily stressed, said NBC. They would pick themselves up mentally. Not because they have a newfound gratefulness for the wonders of the advanced world, but because they are aware of and are inspired by the millions who survive without clean water and whose health and nutrition, education, and safety is all at a constant risk, says NBC. While comparing oneself to others is generally frowned upon, in the case of anxiety-driven Americans, it can be argued that if Americans were more aware of their comparatively incredible condition, they would feel less of a need to dedicate their time and money to medications for their mental health. Adversely, many Americans argue that suffering in silence should be discouraged, which is why talking to your PCP about your mental health is encouraged. A PCP is a mental care provider who practices general medicine but can refer you to a mental health professional who can aptly prescribe medications, says Children's Mental Health. Many types of mental health professionals exist, from physicians to psychiatrists to psychologists, and they all play varying roles in making sure the patients receive the right treatment. Therapists would argue that ensuring patients receive the right treatment doesn't just involve prescribing the right medication, but also utilizing psychotherapy that can be used alongside medications, says NIMH. Doctors know that solely prescribing medication without any additional treatment could lead to misuse of the prescription. This is why it is emphasized by doctors that the effectiveness of the medications is partially dependent on the patient's willingness to follow through with the advice of their doctor. Readers may accept that seeking a mental health professional is wise if one is worried about their mental health, but may still ask, what uses do prescribed medications have? People who experience life-hindering levels of anxiety have found a lot of comfort in anti-anxiety medications that help reduce symptoms of anxiety such as panic attacks and extreme fear or worry, says NIMH. It is argued that this relief can be crucial in securing the lives of those who experience panic attacks, face phobias, and undergo heavy stress but nonetheless need to function at a high level, if not for their families or work, but for themselves. Similarly, antipsychotic meds can be seemingly life-saving to those undergoing terrifying mental disorders, such as psychosis or schizophrenia, which causes the person to experience loss of contact with reality, says NIMH. Psychotic episodes often entail delusions, false beliefs, or hallucinations, which in some severe cases may reduce the person that is suffering to harming themselves or becoming threatening or violent towards others, says NIMH. Such violence has the possibility to escalate to suicide, which makes medical treatment for psychosis quite calculated and readily discussed with caring, eager healthcare professionals. Corporations realize this need people feel for medications and have taken advantage of it. The U.S. Food and Drug Administration, the very thing preventing greedy producers from slowly killing consumers with cost-efficient, harmful products, has just warned numerous companies against illegally selling dietary supplements to consumers and claiming that the supplements treat various mental health issues. This is significant because these 10 companies, among many others, see the mental health crisis as an opportunity, one that will reap lots of money due to the population's rising susceptibility to depression and mental health issues in this dreary age of online school and isolation. These companies sold unapproved new drugs that could potentially harm consumers under the title of dietary supplements to avoid inspection from the government. Someone argued that this allows the true priorities of drug companies to rise to the surface, that being money over helping people. Companies aren't the only groups benefiting from this mental health crisis. Doctors are also faced with this high demand for mental health help and must make compromises to save time and money. When psychiatrists spend less time on each patient, non-pharmacological therapies, which are more time-consuming, get pushed aside, says Kukreha. This includes sophisticated psychotherapies that can address issues like self-defeating ways of thinking, irrational fears, or difficulty coping with situations at home, school, or work, says NIMH. Another devastating consequence that one might argue is that saving time forces doctors to resort to quick fixes to the patient's complaints, often leading to the administration of medications to an individual who may not require them, says Kukreha. The National Institute of Mental Health recommends that psychotherapies that I find can be effective. However, the institute's faith in these methods rests on the assumption that all therapists utilizing these psychotherapists are of the same quality and administer them properly and equally with other medications. Readers may still stand firm that the people administering these drugs have the patient's health in mind, and that a calibrated combination of even numerous medications is meant to and is proven to help people. However, many might change their minds when they realize that medications are not as effective as perceived. While Johns Hopkins Medicine may accept the rate that 33% of people with depression don't respond to multiple kinds of conventional antidepressants, not everyone does, and finds this statistic to be a clear indication of why antidepressants should be avoided in the first place. Which makes some wonder, why is medication treatment so common if it so commonly doesn't work? Many would suggest that those soothing tactics used by doctors, and previously mentioned by yours truly, being open about negative effects, trusting the professional doctor's advice, comforts patients, making them more likely to pay for a prescription that, if isn't needed, is prone to leading patients to polypharmacy that will cost the patient their body and money. Johns Hopkins Medicine also advertises a drug called exoketamine, which reduces depression symptoms in a majority of clinical trials. Those opposed to medication treatment often point out that the key word of symptoms, as previously established, solely using the effects of medications will not solve the issue causing problems. It will merely push aside the symptoms, not effectively helping people, but rather slowing the process and effectively making doctors and drug companies more money with the prolonged use of medications. At the end of the day, doctors of any degree, prescribing pills or not, want people to be healthy. At least that's what I want to say. Companies manufacturing our medications, therapists handing them out, the people we put our trust into most, have sacrificed their integrity to quietly and in a caring tone make more money by feeding into the poor mental health of this nation. By encouraging people to pull away from medications and search for relief in other ways, our nation will grow into a cleaner and happier country where people can shed their stressful cloaks and doctors can get back to helping the people who suffer from disorders and not complaints. In order to make productive steps towards a cleaner and healthier society, the legitimate, effective uses of medications must be acknowledged, while the ineffective uses of medications must be diminished. I propose the presidents, TikTokers, church leaders, all people of influence address the world on the mental health crisis. The speakers should strive to avoid undermining the legitimate mental health issues people are battling, while still encouraging citizens to take some responsibility for their mental state, pull away from unnecessary medications, and work towards a cleaner, healthier, happier country that is ever so grateful to live in such a safe and plentiful nation. This effort should not be a one-off, but rather a daily reminder of the chance people have to make most of their one and only life. Gratefulness, like all things, takes practice. The FDA must also be restructured in a way that's not influenced by the wants and needs of the people in power, but rather influenced strictly by the principle of the administration, that being protecting the public health. Finally, mental health professionals of any kind need to be encouraged, or rather regulated, from using medication as a go-to. Existing and new doctors must be educated at a higher level to ensure the integrity and quality in our doctors is not broken, and we, the stressed out people, can escape to a pure life.